everyone. Welcome back to another episode of Making a Difference in Mental Health. I'm your host, Danielle.
I'm your co-host, Wendy.
Wendy, who do we have today?
It's Friday. First of all, happy Friday to everybody. So we have a returning guest. Super excited to welcome back Chelsi. Chelsi was on season 2. And, we love to spotlight our staff here at ABH because everybody's so talented and everybody has great specialties. And so we want to keep our audience well informed of all the creative things that we do here at ABH. So Chelsi's back to tell us about her journey since we talked to her last. She was learning a particular parenting technique and now she's certified. So hooray.
Yes.
So she's here to kind of tell us what it's been like and how's it working with her clients and, just share some general information with all of us. So welcome, Chelsi.
Thank you. Yes.
So reintroduce yourself to the audience just in case they're just meeting you for the first time, or if we have some returning viewers from last season.
All right. So my name is Chelsi. I am a therapist here at ABH. I'm working out of Montgomery County, and I've been working with ABH since 2017. So a little over 5 years, almost 6 years now, I think.
Yeah, really?
Yeah. So, and like you guys mentioned, last time we talked, I was in the process of learning a parenting technique or therapy called parent management training. And as of October last year, I'm officially certified. So I'm certified in parent management training.
Okay, so since you're certified, we're going right into the interview. Can you tell us a little bit about what it is or describe the interventions that you may use? Let our audience know.
Okay, so parent management training is in simple terms, it's a therapy designed to help parents who have kids who are struggling with behavior challenges. So I work with the parent and I teach the parent skills each week. It's a structured therapy program that's 12 to 15 weeks long. And I work with the parent to help them develop skills that they need to help the kids that are struggling with behavior challenges.
Okay.
Great. What kind of behaviors, Chelsi, are you seeing that parents are struggling with?
So it can be, I use mild behavior problems like defiance or typical temper tantrums, like yelling, throwing things. So more typical behavior challenges like that versus to more atypical behavior challenges. So more like threatening others, like severe aggression, stealing, frequent compulsive lying, so things like that. So anywhere from a mild to a more severe spectrum of behavior challenges.
Have parents noticed? I love to, with my therapist here in the Greenbelt side, I always get them to ask one major question: what was your life before the pandemic, and what's your life after the pandemic? So in this space of doing this parenting therapy technique, do parents tell you or describe marked differences between the kids before the pandemic and then after the pandemic? Because I think it's just added so many layers to our kids and their ability to cope and function,
Yeah, I mean, parents I've heard are struggling more with behavior challenges, and teachers are struggling more with behavior challenges. So I think I see it across the board, whether I'm working with a parent and or teachers. I think we're all seeing I would say a pretty notable increase in behavior challenges amongst the elementary school kids, which is the typical age that I work with.
Oh, Chelsi, I definitely wanted to comment because as many of our viewers may know, I work for the community schools program with advanced behavioral health, where therapists and counselors are placed into the school during the day to provide additional supports for their mental health team, the IEP team, the special education team. And so, yes, post COVID, we've definitely seen an increase of, like you said, the defiant behaviors, as young as the elementary schoolers, like first grade, second grade, third grade. And I think this particular intervention is really good for the parents, because as the therapist, we're trying to treat things that are symptomatic of the child, of like oppositional behaviors or defiant behaviors, or, just kind of those behaviors that are kind of maladaptive to just regular everyday functioning for a kid and socialization. But we're definitely seeing an increase of that in the school system. So while we're working with the kids, on the other end, this is a really good program to work with the parents. And so that kind of moves us right into the next question about how is it successful? This type of intervention, is it successful? And, can parents benefit from it? And I really wish that we had maybe like a list, or if you can email us a list of like simple things that we can do, even to help the kids at school, because I would definitely use some of the techniques. But tell us about the interventions and the success rate.
So the success rate is like extremely high. It's like over 80% success rate, which is like higher than
good.
Yeah. And the caveat, or like the challenge, is that it requires like highly motivated parents, because it's a short-term program, but it's work in that short term, right? So the success rate is for those parents that make it through the program. I'm actually doing a group right now, and for the parents that have stuck with it, because it's been long, we're like an hour and a half every week, and it's a long group, right? And in the evening, but these parents are super committed, and they're all seeing improvement. They're all like, generally every time we meet, things are going much smoother. And so it's really it's a relief in some respect for a lot of parents that put in the work and then see the benefit from it.
Right.
So Chelsi, tell us, how receptive is this to the teachers? Because, here we talk about, again, teachers are, we're burned out, tired, disrespected, have no patience, have no energy. And, they always default to a negative way of interacting with kids, punishments and things like that. So as you mentioned earlier, you're working with teachers to help teachers kind of learn this model and apply it, I guess, in their classroom. So tell us a little bit about that.
Well, I think like when the teacher is able, given when they're able, because they have an incredible workload, like on a good day without any behaviors. But then we throw in these behavior challenges, and it makes a hard job so much more difficult. But the good news is when the teachers are like willing and able, I basically would work with the teacher to reframe how they're thinking about the behaviors, which changes how they then respond to the behaviors, or if they even respond to the behaviors. And I'll give you an example, because teachers will have kids in line, right? And then there's 2 or 3 kids out of line, but 98% of the classroom is standing in line appropriately. What are we more inclined to do?
Get to the 3 kids, right?
Yes.
And yell at them for not
correct them, which for those kids are the kids that are going to react explosively sometimes to that correction. So what I would do, and what I do with parents, is like focus on that 98% and reinforce that. Give very little attention to the kids that are outside of the line, and praise the kids that are in line, because then you're more likely to motivate those kids indirectly that are not in line to get in line.
Right. I am thinking of a teacher right now at my school that could use that particular technique of kind of redirecting and even reframing their thought process, and the praise of the 98%. And really quickly, I know that you said that you meet with the parents for an hour and a half every week. How long is the program? Is it like a year long? Is it something that's ongoing?
But so the best part is it can be as short as 12 weeks, sometimes even shorter, depending on how much improvement they're having, because not every family needs every skill. So I think every skill is beneficial, but if like we're 7 weeks into the program and they're seeing significant improvements, it's really not even necessary to go through all the skills if they don't need all the skills, depending on what the behavior challenge was that they were struggling with.
So when you do with teachers, I'm fascinated by this because we have constant conversations down here in the Greenbelt office because of the work we do in the school system here in PG, and having trying to redirect teachers as a community schools therapist is so extremely difficult. So Chelsi, are you meeting with the teachers independently? Are you going to the school? Can you just elaborate a little bit more about that?
Well, I would love to be able to like do like trainings with teachers on this. And because what I love about PMT is when I'm working with parents is that it's never the parent's fault, the behavior, but it's how they respond to the behavior that can really help or escalate the situation with these specific kids that we're working with. So when I'm teaching this to parents or teachers, it's coming from a place of, you're not the problem, but you can be the solution here. And here's how you do that. And here's why you do that. And I go into like the relationship between attention and behavior. And so the more attention we give to the negative, even though it's not on a conscious level, kids don't do something because they get attention for it. But the more attention we give to it, the more we're creating a cycle of negative behavior. So I feel like I was punished, and now I feel mad, and now I'm going to throw something, and now the teacher's mad, and now I'm punished at home because I didn't do well at school, and so I go to school resenting the teacher for calling and it's
viral, like a domino effect. So I wanted to even stay here for a moment. So I love the example that you gave of the 3 kids out of line, and our probably natural instinct or innate instinct would be to correct those 3. And you said to praise. Can you give us an example of, say I'm a teacher and I have a classroom of 15 students. I have the 3 that are out of line. What would I say? I know now about the 98%, but can you give me like a real life example of how I would address my classroom?
Yeah. So when we're talking about praising, we want to praise specific behavior, right? And we want to be close to the kids when we're praising. So I might closely, calmly, and quietly, and I'm not throwing those other 3 kids under the bus, but genuinely praising, hey, bud, I really appreciate your hands to yourself. Your feet are still, and I'm so proud of you. Give me a quiet high five. And then I'm going to walk down a couple more students and I'm going to do the same thing. And I'm going to be intentionally calm and quiet so that I'm modeling calm and quiet behavior. The kids are more likely to see me praising and high-fiving, and then they're more likely to hurry up and get in line so they can get that same kind of positive feedback.
Have you ever seen that backfire?
Only usually if it does backfire, it's because people are throwing kids under the bus or like siblings under the bus when they're doing that. So I'm like very clear.
Something like, oh, Danielle, thanks for getting in line. Give me a high five. And Wendy, you're not like calling out the
You're
other.
Not being like your other peers who are having a really hard time.
Right. Okay. So that makes sense. And when I tell you I'm thinking about a specific teacher, I really think this would be good for that teacher. And I love how you were talking about how even those 3 kids were, let's just stick with the example of the 3 kids, they might fall back in line. So with the question or with the thought about kids, our question is, how do kids receive this particular intervention?
So the beauty of it is it's drama free. It's very minimally punishment focused. Now there are techniques in the program that include punishment, but the punishment is so mild and it's planned in advance. So these kids don't like these out of the blue punishments, right? These kids want to know, okay, so if I'm aggressive, that's a timeout behavior. And I'll pop quiz you guys. Do you guys know how long a timeout should be for it to be effective? And this
hours, of course. Right. I remember, do you remember, was it like it was some type of nanny? I can't remember. It was like 911 or rescue nanny or something like that, where it was like their punishment should be per their age. I don't know if that's right or not. But
well, that is
minutes.
Yeah. So I say, they say really for a punishment to be effective, it only has to be 1 minute. A timeout should only be 1 minute. It can be up to 8 minutes, but after 8 minutes, it becomes an aversive, harsh punishment, which then backfires. So that's where we create this harsh cycle of negativity. So I work with parents and teachers to really minimize the punishment, because for a punishment to be effective, it really should be brief and immediate in response to the behavior.
So you are talking to the parents who say, you did XYZ at school, I don't like it, give me your cell phone, you don't have it for 4 or 5 weeks, 8, 9, 10 months.
Yeah.
Yes. No, that's true. I have students who
we
still
have
have
parents that do that.
We're in the fourth quarter or almost fourth quarter, and they still have not gotten back there outside of their homework. No electronics.
So I'm hoping
that's the thing.
And
our members are listening, because that is a very, very important, valid point, that your punishment needs to make sense. And I like it.
And it needs to be proactive.
Right. And it's
we need to have a conversation.
It's adverse.
Yeah. And I, to be honest, I say to a lot of parents, and I use the example of if we have a hard day at work, if we had a hard day at work and our boss was on us all day, and then we came home and our partner got on us about having a hard day at work, can we imagine? Can you imagine? You go home for relief and you come home to more punishment? So I really try to avoid punishing for school behavior for that reason. Now, we can praise positive school behavior, and we can have them have to earn certain privileges after school for positive school behavior, and then therefore they lose a privilege, but it's not like a punishment. It's something that I had to earn, so I just didn't earn it, if that makes sense. There's a difference between you have everything and I'm going to take it away versus you have to earn the things that you have. So I really try to shy parents away from punishing for school behavior, because it really doesn't help. It just depletes the kids' motivation to change.
Right. Yeah. I've never known it to help. And then, like I said, the punishments become out of control.
Yeah.
Then they wonder why it's not having the desired effect.
Exactly.
Unreasonable. So good point.
Yep. So our next question would be kind of taking it from a space of, are there any red flags? Like, what are some red flags that you can speak about in regards to either the parents, the children, teachers, or just things in general that we should know about, just kind of keep our eye on?
When you say red flags, describe that more. Like
a behavior that stands out, or...
Well, so with this program, it really simplifies things. And so you could tell me a super egregious behavior, whether it's fire setting or harming animals or just no empathy. And we're gonna talk about how to work on that. There's never a behavior that can't be worked on. When it comes to oppositional or antisocial behaviors and things like that, there's always a way to work on it. And in the program, the biggest thing that we talk about is the positive opposite. So instead of focusing on the behavior that we want to stop, I help parents identify what is the positive opposite behavior that you want to work on, and let's work on increasing that.
Okay, can you give an example? I like what it. I think I like what it sounds like. A positive opposite. Maybe because it sounds like an oxymoron. It sounds like it doesn't match. So tell us what that is. A positive opposite.
So think about if the kid is. Well, actually, I'll tell you guys. If I say don't think of a pink elephant, stop thinking of a pink elephant. You guys do not think of a pink elephant. If you think of a pink elephant, you're grounded. What are you more likely to be thinking of?
I'm thinking of a pink elephant right now.
Okay. If I don't want you to think of a pink elephant, I'm going to talk about what we should be thinking about instead. Let's think about a cloud in the sky and flowers growing in the garden. You're less likely to focus on what I don't want you to focus on if I'm telling you what I do want you to focus on.
Yeah, that's so true. Just think about it. When people always tell you that, don't look at that, or don't think about it.
Don't look over there.
And you're looking over there. Don't watch the car accident.
Or like, I don't know if this happened with you, but like, don't touch anything in the store.
Yeah.
Yes.
Don't ask for anything.
Right. And
we're going to eat when we get home. And so now you're thinking, don't touch anything in the store. And now you're, as a little kid, you're more drawn to want to touch things.
Like that
you're hungry.
You want McDonald's or Chick-fil-A or something like that.
Yeah.
That makes perfectly good sense. Great explanation.
Yes,
so that people can really grasp what that concept is.
I'm loving how you're describing this. And I want to kind of go back before we, kind of close out. When you were talking, Chelsi, I love how you said there's almost no form of behavior that can't be addressed. And so as I was listening to you from a clinical space, I'm thinking of the DSM-5 and I'm thinking of conduct disorder. I think you said something like oppositional defiance. I'm thinking of antisocial. I think you said that as well. And I mean, you didn't say it for our listeners. These are diagnoses from the DSM-5, what we use to diagnose, but you were describing the characteristics of or symptoms of this type of diagnosis or these types of behaviors. And based on what you're saying, you can still address it through PMT, and it helps parents, and it also provides for psychoeducation all along the way. So I really like it.
Yeah. So PMT is actually evidence-based for oppositional defiant disorder, disruptive mood dysregulation disorder, ADHD, because a lot of the impulsive behaviors come from like ADHD and just poor like impulse control and frustration tolerance, and antisocial behavior and conduct disorder. So it's evidence-based for those very diagnoses that you mentioned.
That's really good. That's really good. I'm really hoping that you can. Well, I mean, we're kind of coming down to the end, and we always like to end with like tips that you can potentially share. But can you kind of like list them, because mentally I'm taking notes to take to school.
I'm using it in
yes.
So like my top tips. So the first one, like we had just gone over, is the positive opposite. As parents, we always want to focus on increasing the behavior that we want to see, and we want to be less focused on stopping the behavior that we want to stop. So if we want to stop the behavior, I'm going to ask you, what is the behavior that you want to see, and how can we focus on increasing that behavior? How can we set the child up for success in increasing that behavior? Another tip I have is practicing the behavior that we want to see. So literally role playing it frequently. And I use the analogy of like basketball or homework. We're not going to be ready for the test in school, or we're not going to be ready for game time at basketball if we're never practicing, and behavior is no different. So we really, for teachers, like practicing walking out of the room calmly when a kid tells them something that they don't like, or going to the calming center, like having I don't know what the word is, like an immersive or like an actual physical feeling of role playing that, acting it out, and praising and rewarding them for that. So practice makes a huge difference. Role playing behavior that you want to see makes a huge difference. And minimizing punishment. And I know it's the opposite of what we think, but like we mentioned before, for punishment to be effective, it really only needs to be like a minute, and it should be proactive. So we should say that, hey, if this is the behavior that's happening, when that aggressive behavior happens or that verbal aggression happens, we go take a 1 minute space. And you don't have to call it timeout, but take 1 minute space and set a timer. What else? The power of praise and positive reinforcement. And I think there's some stigma out there about like praise or bribing or rewarding kids, but it's different. Like we're motivating kids to do what they're having a hard time doing. And we all, even as adults, work on that. Like we come to work because we love it, right? That's part of it. And we get paid to do it. Right? We need that motivation, that monetary or token motivation, and kids a lot of times need that too. And so positive reinforcement plays a huge role in motivating kids toward behavior change. Let me think about, I think those would be like my top tips.
I like that you said like an actual physical immersive calming space. So I'm gonna do a little plug.
Go ahead.
I'm gonna do a little plug.
Plug away.
I'll say recently, because I don't know when you all are watching this, viewers. I don't know if you're watching this in March 2023, April 2023, or December 2023. But I'll just say recently, the school that I am able to provide services for, we opened, we had a grand opening. Wendy was able to attend. It was a ribbon cutting ceremony, and it includes a reading space, but it also includes a calming space. And so it includes SEL, or social emotional learning activities and exercises and interventions, as well as PBIS, which is also positive behavioral interventions and supports. We have a specific space, and the spaces are actually color coded. So the calming space is blue, and it's a soft kind of muted blue. There are activities that can be done. There's an actual SEL game that one of the school psychologists and her son developed, and so it's in our room, and our mascot is an eagle, so it's called the Eagle's Nest,
and it's decorated lovely, like you're in a nice, warm, cozy. I
want to come visit.
Beautiful. It was absolutely beautiful. Yes. I was very honored to attend the groundbreaking.
So I think PMT would be such a great thing to have, even our PTA, our parents that are involved in a PTA, or some of the parents who are having, like I said, I'm thinking about a teacher, I'm thinking about a couple of parents who would so benefit from learning these techniques that you've told us about today. But in the interim and in the meantime, I'm going to take a little bit of what you said and utilize that space, that calming space, to, kind of maybe take the child out of the setting for just a moment. I don't know if that's okay, but to kind of reinforce, or like you said, to focus more on the positive. What is it? The opposite. Can you say it for me one time?
The positive opposite.
Positive opposite. So at least in my school, there is a space for that. And there's a space for learning PMT and all of these other interventions that can increase and improve, and we can, actually see positive behaviors from behaviors that might have been defiant before. So I'm really excited that we had you on here today. I'm excited that since the last time we saw you, you're certified, you've got groups going on.
You're going to train us.
Exactly. Yes. I really have enjoyed just this little bit that you've given us, and for the hard work that you've done to even get through the program. Congratulations to that.
Always looking for, what I love about it is you're taking the focus off the kid. It's always, everything that we've been trained to do, learned to do. It's always like, it's the kid, it's the kid, it's the kid. And it's refreshing to see, no, not necessarily. Let's try to teach parents a different way to parent through a positive space. So I love like tone and tenor, calm. I love the positive opposite. It makes sense when you explain it. I was like, oh yeah, that does make sense. If you really think about it, why am I giving so much space and energy to the negativity? Like shifting and getting them to focus more on what we want them to do and a positive thing. So I have thoroughly enjoyed this. Chelsea, I needed to hear this like in my child welfare training, because these were the kinds of parents that I would struggle with.
That's what I wanted. I hope to work with like CPS in the future and really helping parents with handling aggressive children and like their behaviors, because I think unfortunately it can escalate to the point where the parent is responding aggressively. And through this program, my hope is to help parents to know what to do and to feel empowered and to have self-control in these situations that can help without it ever getting to that.
So I think definitely making, we get the referrals on the kids, but I think we need to be getting the referrals, more on the parents to be in something like this that you are teaching.
Exactly.
And so I love this. I'm excited. I'm very excited. I've learned. I think, it's a good thing. I think you'll take it to school.
I really, and just kind of, can you tell us I guess maybe how you got into the program. I know you talked about it last season, but really quickly, how did you get into the program? And if there are any other clinicians that are watching, how could they too kind of pursue learning PMT?
Well, it's a little self-disclosure. I got into the program because from birth, my youngest son was strong-willed and passionate. Like,
I love that.
so,
Right, that's a very positive way
You are walking the talk.
Yes, you are.
yes. And I was like taking him to the pediatrician. I took him to Kennedy Krieger, and I'm like, I'm a child therapist. I know the things. We're working on deep breathing. We're working on talking about our feelings, like what's going on. And I researched and found this therapy, and it worked with my son. And that's really where I developed this passion, because I saw that, okay, there's so much that we can do to help, and so much less that we should be doing that, that ends up escalating situations rather than helping our child. And so that's how I got into it, is because to help my son, who has ADHD and was struggling with a lot of behavior challenges.
Well, I think a lot of people could benefit, parents, teachers, therapists, counselors, those who really want to kind of shift and change even the approaches to correcting behavior, to have a more positive spin on it. Like, I like how you described your son versus maybe a negative connotation. Yeah. But you've built him up in that way, that's his personality and his character, right? But using PMT to kind of steer and guide so that every day is a good functioning day, right?
Yeah.
So yes, I'm just so glad to have you, Chelsi. This was good.
I'm excited to be here. I just want to let everyone know about PMT, whether it's schools, parents, whoever it is. Like, I just want to get the word out, like, learn about PMT, use PMT, because really, even for people, like even businesses, like we should all be like in this mindset where we're focusing on the desired thing and really reinforcing that.
Absolutely. So we will definitely probably have you back.
Yes.
As we carry on this conversation, because people need to hear it more and more and more and more. And Danielle and I like to, if it's something that's really important and it's good information, we have people come back on and talk about it, because sometimes our audience members might miss the first time we chat about it. They might not have seen season 2 where you were starting to talk about it. So hopefully in this season they'll watch it, and as Danielle said, hear what you're saying, take some of those quick skills, apply them to their sessions, apply them to school, apply them to work, wherever people are struggling with a lot of negative behavior. So thank you so much, Chelsi.
Yes. Thank you so much for having me.
To be a regular girl.
I love it.
I know. So yes, again, Chelsi, thank you so much. Thank you for watching. My name is Danielle.
I'm Wendy.
This is Making a Difference in Mental Health, where we're always striving to make a difference in mental health. We'll see you next time.
Take care.
Bye.